Welcome to the World Congress of Cardiometabolic Medicine 2019 in Mumbai. We have a pleasure, and I really feel honored to have Dr. Pendsey with me. I don't think he needs any introduction. He himself is a big giant of diabetes and lipidologist back home in his own city of central part of Nagpur. Correct me if I'm wrong.
It's Central India.
And I think he has done so many noble causes, and he has been working for the NGO, which is basically working on the juvenile type 1 diabetes metabolic disease. And to add one more thing onto his, basically, I just got to know, I was reading your profile, and I got to know that you have been known for a diabetic foot. Tell us more about this diabetic foot. How do you know? Would that be wrong if I call you a person of a diabetic foot?
Yeah, I mean, diabetic foot is one of the chronic complications of diabetes because of loss of sensations. They have neuropathy, and therefore they get injuries which are not looked after, and they become non-healing wounds. Secondly, they have peripheral vascular disease, which obstructs the blood flow and thus reduces blood to the foot. And if there is an injury, the wound doesn't heal, it is very painful, leads to gangrene and often a limb amputation. You will be surprised, we have 100,000 limbs are being amputated in our country every year.
That's a huge burden. That's truly a huge burden. If I may ask you about a big question, that if you have a diabetes-related vascular complication, which overrules what? Is the peripheral vascular disease more common than CAD, or converse is true?
Coronary artery disease is certainly more common than peripheral vascular disease. But if a person has peripheral vascular disease, it's a surrogate marker of coronary artery disease. So you can be almost sure that patient also has a significant...
So if somebody is coming to you for peripheral lower limb vessel disease, it won't be wrong to send him for the coronary angiogram?
It's not always necessary, but we have to keep in mind that his coronaries are...
a little bit more vigilant about that. So you have to keep your eyes more open, because and more cautious about that.
If we do peripheral angiography, additionally do coronary, it's a much contrast load on the patient, and these patients have compromised kidneys, and so we have to be careful and manage the acute problem first.
So, I mean, to have you on the platform of the WCCMM is truly a prestige and honor for us. Tell us, are you presenting something about your research and publication in this big conference today?
Yes, I have been publishing, and...
are you presenting something today?
Yes, presentations on diabetes.
Could you walk us about your presentation today?
This conference?
Yeah.
This conference, I'm going to speak on ketogenic diet.
Oh, that's a very interesting topic, ketogenic diet. Tell us more about that, please.
Ketogenic diet is a very different form of diet where carbohydrate intake is reduced from usual 50 to 60% to only 5%. And in turn, to compensate, 70% of the calories come from fats.
And this is the trans-saturated fat. Is it the trans-saturated fat?
Yes, it's saturated and polyunsaturated, both fats, but since it's more commonly prescribed for non-vegetarians, it becomes a rich source of saturated fat.
What do you say a message about the people who are enthusiastic gym goers? You see a lot of the young buddies nowadays, they work in and out in the gym for hours and hours together.
Yes.
And I'm not sure whether they are properly guided or rather misguided in that context to have more protein diet. Will that be a good thing to do it?
I am not very much in favor of giving very high protein diet, because most
and what should be the ideal content of the protein diet?
The content of the 24 hours calorie content should be not more than 25% of the calories coming from proteins.
I see.
As such, if most of the Indians are vegetarians most of the time, and it's very difficult to achieve 20% proteins.
And do you think it's a good thing to be vegetarian in that sense? By the way, I know it's kind of a diplomatic question, but I guess I have to ask somebody to give a message to my common audiences.
One should have vegetarian diet as a routine, and once in a week or twice in a week expose once to a non-vegetarian food like chicken or white meat.
Yeah,
I would go for that.
Would you like to summarize your talks in few points to message to our audience that what they should be taking care of while having a diet in that sense?
Basically, one has to be very conscious about our diet intake, because the obesity is rising in epidemic form in our country, and you will be surprised to know there are 170 million overweight and obese people in India, and childhood obesity is a big upcoming problem in our country. And by 2030, we'll have more than 340 million obese adults. So it's going to be a huge
burden. It's really a big burden.
It will be next to China.
I mean, if I don't think, correct me if I'm wrong. I mean, when I was in medical school days, I used to hear that people are more malnutrition, undernutrition, but that was about a decade or two ago. However, what we are seeing, the trend now is reversing. People are going more on the diabetes, from obese and metabolic syndrome and whatnot. So what do you think, what probably have affected such a big change over a period of decades?
India went through a transformation in last 3 decades.
And do you think it's a good thing?
Lifestyle suddenly changed. Urbanization became a rule, and therefore most of these who migrated from villages to urban areas have started putting on weight, because they were first time exposed to all sorts of food alternatives.
So you're basically naive to the trans-saturated fat, and suddenly you're exposed to it.
It's not necessarily only fat.
I see.
It's mostly the most dangerous is carbohydrate.
It's a combination of the things.
And yes, exposure to over-calorie and carbohydrates. Of course, the fats come, and it's not so easy to increase protein intake. So most of the adults indulge in carbohydrate diets like sweet.
So you're trying to say that prevention is better than the cure in that sense?
Yes, one has to be very observant with our diet intake and keep a record of body weight, because it slips within few months out of your range, and you suddenly see your clothes getting tighter and your tummy coming out. So, and then it's very late. It's very difficult to lose weight, most difficult. And most difficult is to maintain the lost weight. If you succeed in losing 5 to 10 kgs, it's very difficult to sustain that weight, lost weight. The rebound weight gain is a rule.
So it was really a pleasure talking to you, Mr. Pendsey.
Yes.
Thank you very much for being with us on the show. Thanks a lot.
Thank you.